Hi, I'm Jess from Dorchester Arts. I am the Community Engagement Manager, and we operate out of this amazing building that you are in today. At Dorchester Arts, we believe that where the arts thrive, people and places do. We believe that through creativity and by interacting with arts and culture, it can make all the difference when it comes to health and well-being. It's about having the time and the space to connect creatively, to feel inspired, and to be equipped with tools towards better resilience, confidence, well-being, and health. The arts really are the superpower for changing lives. I'd like to share with you today some of the programs that we offer at Dorchester Arts and give you a glimpse into the amazing work of creative health. So these are the programs that we are offering at the moment, or that we run at the moment. RISE is our creative therapy program for mums with postnatal depression and anxiety. We run a 12-week program with the mums, and we have an on-site creche so that the mums can bring their babies to the creche and have 2 hours of creative therapy time so that they're able to then get the support and help that they need. The program is run by a creative therapy tutor, and we also have a perinatal mental health specialist as a peer supporter within the session. Our creche workers are all trained as childcare providers, and they also work with the mums and kind of helping the babies to socialise and to help with that bonding process as well. We run those courses both at Dorchester here, and we run them in Sherborne as well. Sing Together is our Singing for Wellbeing group. We have that operating just in Dorchester at the moment. And it's a real mix of people that come to that, some with health conditions, some of our Parkinson's, dance participants come along to that. But generally it's about understanding that singing is just good for you. Connect is our all-inclusive drama group. We have a real range of abilities, experiences, backgrounds that come to that group. Everything from special educational needs to medical conditions, to people that are just feeling a little bit lonely and are kind of have nowhere else to go, or that they are generally interested in doing some drama workshops. So it's a real mix of people that come to that program. Elevate is one of our newest programs, which is a dance program for multiple sclerosis, specifically for those with MS, which was designed by Scottish Ballet. I'll talk a little bit more about who we're working in partnership with in a little bit. Art for Memory is our program for dementia or early memory loss, and Parkinson's Dance, which I'm sure needs no introduction in terms of that's been running for quite a while. I think we're in our 8th or 10th year of running that now, somewhere around those, so it's been going for a long time. So those are the programs that we have. Some of them run in Dorchester, some of them run in Sherborne. We've got a new program that we're due to start working with an organisation called Art Life, which is, again, we've got some funding to run 3 6-week pilots, which is using art to work with people who have low-level mental health challenges. Each session is 3 hours and runs for 6 weeks. So we're just about to start that. It already runs in Sherborne. The organisation Art Life already exists in Sherborne, and we're partnering with them to bring that to Dorchester. Thank you. So some of the feedback and things that I'd like to kind of talk to, and one of the things for me that I think is really important is those face-to-face hours that we are able to give, that sometimes some of these people or some of they're going to the doctor's surgery, if we're looking at isolation or loneliness, they're wanting somebody to talk to, they're wanting somebody to see. And even our just most basic Connect that is here for an hour and a half, for that one person, that can be up to 57 hours of face-to-face time, either with one of our practitioners or just being with other people. And obviously that's a minimum. And so it's a huge amount of hours that we are able to provide for those people that need it. Our RISE is one of our newest programs, and probably the one that we use a lot more kind of data. We use the Warwick-Edinburgh mental wellbeing scale to assess where our mums are when they come into our program. It kind of gives us an idea of when they get there, kind of to pitch where they are, to see where they are, to know what support they need. But also it helps for us to see where they are at the end of the course. And there's just some statistics there for you to see. So 93% of the mums made a meaningful positive change to their mental health after attending 12 weeks with us. And obviously you can see where they were before in terms of low well-being and to where they had got to at the end of the 12 weeks, moving themselves into kind of moderate well-being. Now, we would hope that they would then continue on that level, using the skills and the toolkits that we've provided them to keep their well-being and mental health going on an upwards movement. I'm not going to read these out, but these are some of the things that our participants have said. So I'll give you a chance to read through them and kind of pinpoint some of the things that are really what I think stand out for me. For us, it's about providing them with a toolkit. So one of the mums a little bit earlier talks about things that they can then do at home when they're feeling anxious, things that they can do. So they're not just when they're with us, it's things that they can do at home. We know that's the same for Parkinson's, and we know that's the same for multiple sclerosis. They're able to do those activities at home if they're feeling that maybe their posture or their balance is off that day. What can they do? Things that they can do at home that they have learnt in the sessions with us to help their well-being, to help with their health. Some of the other things is about being with people that are going through the same thing. And I've heard that time and time again, people coming into our spaces and saying, it's so nice to be with someone who knows how I'm feeling, particularly for our mums. And again, for those that are working, with Parkinson's, or with have an early diagnosis, this can be a very unknown situation for them. And coming in and being able to talk to people that have actually are going through it, have lived through it, they're able to get that experience for them. And the last thing I want to bring out on that one is about how important it is for the people that are caring for them. And that's either that they're able to bring them to us so that they're able to get an hour's respite, or actually they can participate with them in a positive experience. So we have lots of people that come to our Parkinson's or our multiple sclerosis programs where they're actually able to participate together in a positive way. And it's been absolutely wonderful to see them collaborating together in that way without it always being about their health and looking at it in a kind of a bit more of a, what can we do? It's about them just being together in that moment. So what has worked for us? Building up networks and connections. I invested and spent quite a lot of time trying to find the right people to talk to. Be that the MS nurse, be that the Parkinson's nurse, trying to find the right people. Normally in the creative world, I've got ears everywhere. People always want to, they're open those conversations, but finding the right people to talk to in health can be tricky. But also I believe that has been the absolute key to making these successful. So for RISE, we're working with midwives, health visitors, social workers, early help, Home Start, anyone that maybe comes into contact with mums. And that's the same with trying to then find that for all of the health conditions that we work with. Partnerships. Obviously, Parkinson's Dance, we work with Pavilion Dance, New Forest Arts, and the Octagon Theatre. All of these organisations run Parkinson's Dance, and we run the same Parkinson's Dance science model. The Elevate programme was developed by Scottish Ballet, and we have worked in partnership with them and New Forest Arts. Both of us are delivering the Elevate programme. We are the first in England to deliver that outside of Scotland. And so we are only two organisations that are delivering a specialist movement-based workshop sessions for those with multiple sclerosis. We've worked with Dorset Police and delivered a programme, a dance programme with disengaged boys at Thomas Hardy School. It was phenomenal to see the transformation and the change within those, and we're desperately trying to find a way to continue running that programme to get the boys back here, to create a platform for them. We've worked with Dorset Museum on our Nature Heals programme with Trevor Parsons and run a mindfulness day here with Dorset Mind. Obviously, we're working with Art Life in Sherborne, and we've also got quite a big PMLD provision here that we run, providing access to sensory theatre. So for those that don't often get the opportunity to engage in theatre, we have lots of activities here for that. Have you lost my PowerPoint? What was my last slide? Can you pop it up? I think it's my provocations. Okay, so I haven't got my note, I've written there. So my provocation is, how do we communicate better and co-develop work together? What could happen if we did? Can we change and reverse that format of that conversation? We often, as organisations, can see the gaps or know the gaps because we're on the ground with our communities, and health know where they are as well because they're seeing it in the situations that they're working in. But it's often us that is going, I'm going to put that on for that because I think that it needs it. But actually, can health organisations come to us with the problems that they are facing? Can we help them to fill that gap? Can we create projects together that tackles those issues? Teenage pregnancy. You're not going to just talking at them or putting all that education. Sometimes they need that separation. We're here on the ground, ready to go. And I know there's organisations in here that will be grabbing your opportunities to do that. And so how can we do that? And then my last one is clear referral pathways. How can we create that? How can we get the people who need our services being referred to our services? Be that just so that they're waving a flyer, knowing that it's there, knowing that these provisions are actually there for those people that need it. So that's what I'm suggesting. Thank you.